Welcome back, AP Psych. What's up? We got our new unit on personality coming up. It's a short unit, it's a quick unit, but it has some interesting details in terms of how our personality develops, do our traits remain the same over time, and what drives our personality and who we become ultimately as we grow up. So it kind of relates well to development and the things that we just covered, and more so into our personality specifically. We're going to start with a throwback to the beginning of the year to someone we should all recognize, Sigmund Freud, who was the founder of the psychoanalytic movement, which now is known as the psychodynamic perspective, and their thoughts on how personality develops. So let's get started. We're going to go back to Sigmund Freud and how this psychoanalytic movement started. In his clinical practice, Freud encountered patients who were suffering from these nervous disorders, whose complaints he could not explain from a physical standpoint, right? So he referred to this as hysteria, and said there had to be a psychological cause for the ailments he was seeing. So he needed to come up with a way to address those psychological causes and figure out what was causing them or where they're coming from. This developed the first comprehensive personality theory ever, right? And some of the first therapy ever. So in terms of the unconscious mind and psychodynamic theory of personality, Freud believed that our unconscious mind was full of mostly unacceptable thoughts, wishes, feelings, and memories. And this is that weird part of Freud, right? He thought that they had this unconscious reservoir in our mind of mostly sexual and aggressive urges that pushed us to do the things that we did and made us the people that we are. So to figure out what those unconscious urges and desires were, he would use something called free association, right? And he would ask patients to say whatever came to their mind when he presented them with a word or a picture or something like that, in an attempt to tap their unconscious mind and learn more about what was driving them underneath all of their conscious mind. That was free association, right? So during the process of free association and this chain of thoughts, it would lead to, according to Freud, painful, embarrassing memories that would come up, right? And they would discuss these memories, and they talk about them. And once these memories were retrieved and released, the patient felt better. Right? And this became the first example of psychoanalysis and one of the first kind of talk therapies in psychology, uncovering these unconscious, embarrassing memories that people had essentially repressed. And that kind of develops into psychodynamic theory of personality. So according to Freud and psychodynamic theorists, the mind is kind of like an iceberg. So the largest and most important part is the unconscious mind, right? Hidden from awareness. But at the top, the tip of the iceberg is our consciousness. I would say this is what you're currently aware of. Then you have your pre-conscious. This is info you're not conscious of, but is retrievable as needed. Think of these as memories, things that you could think about and pull up from your mind, but you're not currently thinking about them. For example, think about the first time that you tied your shoes, or the first time you rode a bike, right? You weren't thinking about that before, but we pulled it from your pre-conscious mind and you were able to think about it. The third level is your unconscious. This is out of our awareness, but Freud would say, though, this can dictate your behavior. And he would say this is where those sexual and aggressive urges are coming from that are dictating the way that we behave and are impacting our personality and the way that we develop, right? So in addition to that unconscious mind, Freud's goal of free association helped to bring out some of those issues in the unconscious mind, but they would also do something called dream analysis. We've heard the term latent before in terms of latent learning, but in terms of dream analysis, there would be latent content of your dream and manifest content. The latent content is the symbolic meaning of your dream's images. What is in your unconscious mind? It's the hidden meaning of your dream coming forth. And Freud would ask patients to explain their dreams, analyze them, and uncover the unconscious mind. He also believed in something called the Freudian slip, or slips of the tongue, that Freud believed were our true unconscious thoughts surfacing. Right? We've all made those mistakes before, where you say something you don't think you meant to say, or you say something embarrassing, then you have a slip of the tongue. Freud would argue that those were not necessarily unintended. That was your unconscious mind coming forth and giving us a window into it. So the parts of the personality from the psychodynamic and psychoanalytic perspective, what makes up our personality, there's three parts. You have the id. This is, or some call the ID. This is the unconsciously, which the part of our mind and our personality that unconsciously strives to satisfy those basic sexual and aggressive drives And the id operates on the pleasure principle. This is essentially demanding immediate gratification. This is the side of you that you could think of as like the devil on your shoulder, telling you to do those things that feel good or that you want to do. In the middle, you have your ego. Right? This is our largely conscious mind, and it functions as like the executive. It mediates the demands of the id, and as we'll learn, the superego, and it operates on the reality principle. What can you actually do in this situation? Your personality determines. You have to think about what the id wants, what the superego is telling you to do, and your ego mediates between the two, and you come up with how you behave in your personality. So on the other side is the superego. The angel on your shoulder provides the standards for judgment. It's like your conscience and for future aspirations. Okay? It operates on the moral principle. So your id is always about the pleasure principle and what you want in that moment. The superego is your moral principle and what you know is right and what you should do in the long term. And your ego has to make a decision between those two things. And that helps your personality develop in terms of what you decide to actually do and give into or not. So those are the three parts of the personality according to Freud, psychoanalytic and psychodynamic theory. The ego is our conscious part, right? Within that, we have defense mechanisms. And these help us develop our personality as well. There are these unconscious mental strategies used by the ego to protect itself from anxiety by distorting reality. Okay, so when we have a conflict between the id and the superego, these defense mechanisms can kind of come in to protect our ego and to protect our psyche, to help our personality maintain itself. Essentially explaining how a person's personality develops and functions by managing conflicting internal desires and anxieties, which often stem from early childhood experiences. Remember, psychoanalytic, psychodynamic is always going back to early childhood through these protective behaviors. Right? These are only unhealthy when they cause self-defeating behavior or emotional problems. And we're going to get into some of these self-defeating behaviors, and emotional problems might be defense mechanisms like denial or projection or regression. Right? But these are meant to help protect our personality, and the ones that we give into or use most help us develop our personality as well. So first up in the defense mechanisms category, we have repression. You repress or push something down. We avoid painful thoughts by forcing them into the back of our mind or pushing them into our unconscious mind. This underlies all other defense mechanisms, right? For example, you witness a murder, but you don't remember the details when asked by the police because you've repressed that memory. It's a painful memory that you don't want to bring up, and you kind of repress it and you push it away. And that helps protect your personality, who you are, and your ego. Then you have regression. We've all been here. I'm sure your parents can attest to this. We retreat to behaving or thinking like a child in order to avoid adult issues, right? That moment where your parents give you a consequence or tell you you have to do something and you scream at them, "You're ruining my life." You run to your room and you slam your door, right? Throwing like a temper tantrum like you're a 6 or 7 year old, right? And not a 16, 17, 18 year old. That regression, that would be one of those negative defense mechanisms that can impact the growth and development of your personality in a positive way. Third, you got displacement. This is where you divert that sexual or aggressive impulse to a more acceptable, less threatening person or object, right? Freud would say it was a sexual or aggressive impulse, right? You might be displacing a number of things. But for example, you're angry at your mom, right? So you take that anger out on the family dog, right? You know that it's not acceptable, or it might be threatening to take your anger out on your mom, so you take it out on something less threatening, right? You displace your anger or your feelings onto something else. We've all, I'm sure, done this before. You get angry at someone, but then you snap at a friend, right? Displacement's happening, right? Then we have projection. This is disguises a threatening impulse by attributing them to others, okay? So, for example, you want to break up with your boyfriend or girlfriend, so you accuse him or her of wanting to break up with you, right? You're taking the feelings that you have identified as unacceptable feelings or feelings that you think you shouldn't have, so then you project them onto someone else, right? And claim that they have those feelings instead. Then we have sublimation. Sublimation can be a positive defense mechanism. It's when we expend our energy on pro-social activities in order to avoid undesirable activities. For example, you like to hit things, so you take up boxing as a hobby, right? This is what some of us may refer to as coping strategies, right? You have these feelings that you cannot you cannot let out in a positive way, or you have these feelings that you cannot act upon, so you find a positive outlet for those feelings, right? Someone who has a naturally aggressive personality becoming a football player or a boxer, right? Things like that. Reaction formation. This is where you make an unacceptable impulse into their opposite acceptable form. Okay, so it's kind of like the crying meme, right? With the smile, crying on the inside, smiling on the outside. Essentially, you're saying one thing, but you're feeling another. Okay, so you say you really dislike your psychology teacher on the inside, but you tell everyone how much you love them, right? But you know that you don't. That's a reaction formation because maybe your feelings are unacceptable. So you say the opposite, even though you know it's not true. Okay, just a couple more. So our 7 and 8, rationalization. We do this all the time, right? It helps us protect our personality and keep our psyche intact. We try to create logical explanations of our behavior in order to justify it, right? A lot of rationalization happens around homework, around tests, around reasons why you miss school, things like that. But an example would be you want to go to the movies with your friends. So you justify going instead of studying for the exam by stating that you would have failed anyway, right? I got to go to the movies. I want to go to the movies, but you have a test coming up. I'd fail anyways, right? So you go and you don't study, okay? That's rationalizing your behavior, giving a reason to it to make it make sense. Then you have denial, another classic. We refuse to perceive reality in order to protect ourselves from it. This would be one of those negative defense mechanisms that if you lean into enough can have an impact on your personality. So, for example, you get a rejection letter from the college of your choice, but you still tell everyone you're going there, right? That person is in denial, right? Everybody knows it's not happening, but they're in denial and they have not accepted reality yet. So, how do we evaluate and figure out in today's world in the psychodynamic approach to personality what's going on in someone's unconscious mind to help them assess their personality and understand a little bit more about them and what drives them? Well, we have these unconscious tests, and we evaluate personality from an unconscious mind perspective, and it would require a psychological instrument or a projective test that would reveal the hidden unconscious mind. So there's 2 main projective tests still in use today. You have the thematic apperception test and the Rorschach inkblot test. We're going to touch on each one of those. First, the thematic apperception test, or the TAT, developed by Henry Murray, is a projective test in which people express their inner feelings and interests through stories they make up about ambiguous scenes. Okay, we're going to do a couple of these in class just for fun, but we cannot interpret them. You have to be a licensed psychodynamic therapist to be able to interpret these things, right? But you would look at some of these images and you would write a short story about what you think is happening in the images. And that is supposed to give some insight into your personality and your unconscious mind when the therapist interprets your story and the themes and the actions happening within that story. Okay. Just some more examples. Then we have the Rorschach inkblot test. It's very similar. It's the most widely used projective test. You get a set of 10 ink blots, similar to this one here. And it was designed by Herman Rorschach. It seeks to identify people's inner feelings by analyzing their interpretations of the blots, right? So essentially similar to the thematic apperception test, you're just looking at these blots and you're coming up with, hey, what do you see here? Describe what you see. You're not telling a story like the TAT. You're just describing what you see in the image. And the idea is your unconscious mind is going to come through and give a window into your personality and the way that you think and the emotions you have underlying your conscious mind. So some projective tests, they do have some criticisms, right? Because they are projective. Critics argue that they lack reliability in terms of consistency of results. You could take these tests over and over, right? And you might come up with different stories that aren't consistent, right? So it doesn't really give a window into your unconscious mind, some would argue, or a window into your personality. Then you have validity issues. is it actually predicting what it's supposed to? Is it actually giving us a window into your unconscious mind? Is it actually telling us anything about your personality, the way you think and behave, and how you view the world? Right? So even trained raters evaluating the same patient come up with different interpretations. Right? So that's the reliability issue. And projective tests may misdiagnose a normal individual as someone who has a pathological issue, right? Or someone who might have a mental issue, right? So that's the validity, right? Are we actually assessing what we are meaning to assess with these tests? So that is an overview of the psychodynamic theory of personality. Id, ego, superego all come together to help us form and make decisions in our day-to-day life. And that unconscious mind, according to psychodynamics, is what's driving the development of our personality and the choices that we make. And our mind is protected by defense mechanisms that also impact the way our personality develops and how we show ourselves to the world. So as usual, if you got any questions, let us know. In class, we're going to do some activities to go over these things and hopefully wrap your mind around them a little further. See you in class.